World Health Organization has completed an important study in China looking at the origins of COVID-19. But scientists found their professional opinion was drowned out by politics. Peter Daszak, a member of the WHO-led team, said, and I quote, "I hope the politics steps to one side and let the science speak for once. We've done enough politicking around this pandemic." Even before the report is released, finger-pointing from non-professionals have started. An article by the New York Times titled "On WHO Trip, China Refused to Hand Over Important Data" has been cited by many media outlets, as well as U.S. National Security Advisor Jake Sullivan, who expressed deep concern. However, the report was slammed by two WHO experts for twisting their words and casting doubts over the efforts to uncover the origins of the virus. One said they did have access to critical data, while the other echoed this, saying it was important to stay true to facts. But the blame game never ends. This is the playbook. Before the WHO's research into China, they said China did not dare to open itself to the WHO study. The WHO was invited to China to study. They said the evidence must be covered up. WHO just entered China for isolation. They said China obstructed the WHO study. The WHO study was successfully completed. They said China concealed key data. And the experts present personally denied the statement. They say WHO was bought by China. The truth is not important here. What they want is to hype their theories that China is guilty of causing the COVID-19 pandemic and hiding information. It would certainly disappoint them, as the WHO recommended broadening the search for the virus's origin beyond China. In fact, in this global tracing study, China has been the most open and transparent so far. There were a number of clues, reports, and studies suggesting there were outbreaks in multiple locations around the world as early as the second half of 2019 that are also worth studying. A CDC study found COVID-19 infections in the U.S. in December 2019, indicating the virus was spreading globally weeks before the first cases were reported in China. In a study published in the journal Clinical Infectious Diseases, CDC researchers tested blood samples from 7,389 routine blood donations collected by the American Red Cross from December 13, 2019 to January 17, 2020 for antibodies specific to the COVID-19 virus. They found antibodies in 106 blood donors, which suggested they had been exposed to the virus. Besides, the U.S. currently has the world's largest infected population. Chinese Foreign Ministry spokesman Wang Wenbin said he hopes the U.S. could follow China's example, act in a positive, science-based, and cooperative manner on the origin tracing issue, and invite WHO experts in for a study. The Biden administration has begun re-engaging with the WHO, so being open to such a study might be a good start.